We come in health from very defined roles and very defined professions, so like nurse and physio and doctor and so forth. So I think some of the challenges to meet the new agenda, which people have been working on in universities with practice partners, with service industry for several years, is how do we get to we don't want a role, we want a set of skills, knowledge, behaviour, attributes. When you come from a professional background, you may have a specific lens of looking at things. So I think that discussion, conversations, working together to really challenge ourselves about what we can produce, so that we are making not just nurses for this year or next year, but 5-10 years in the future, anticipating and preventing, as well as sort of addressing the issues of ill health. We know that we haven't got the right number of staff. We know that we need more skills. All the government policies tell us that. Even if we recruited and trained hundreds more students, which of course we are doing, they still wouldn't be enough because of the way people choose to live their lives and the demographics and so forth. So doing the same is not going to resolve the issues of healthcare. And we know that we've got a population that will have comorbidities going forward, people living longer. So when you look at that, it's almost like a perfect storm of, so how do you manage that? There's a whole range of activities that are going on already in healthcare, trying to use the basis of digital technologies to enhance people's lives. And I think our challenge in education is to keep up with that, and hence the reason why it's so important that we're centred in the partnerships that we work with. I think personally change is good, but as I said in my presentation, I think we've got to help people make that change. I think we're very good in health and education saying we're all change agents. Actually, human beings don't actually like change that much, and I think those who do, great, it's exciting, but it's not the way everyone reacts. So personally, I think everybody can change and everybody could use technology. For me, it's about how does that match with my values and beliefs? So do I think that if I use that digital technology, it will help that patient get better quicker? If I do think that, then the reality is I will do it. If I think it might be just about saving money or just another fad or another imposed system, or I haven't got the right equipment, or I've got 5 different systems to work through, so why don't I just write it down? I think that might prevent me. I think most practitioners, if not all, want to do the best for patients. I hear all the time with people that I work with, it's all about making a difference to patient clients' lives. So the technology should assist that and not be a barrier in itself. If we can overcome some of those systems issues, practitioners would be ready to absolutely embrace technology.